Hi, everyone. Dr. Frankie here. Look at the cutest hat that I just got. So, one of my girlfriends, who's a fellow matchmaker, based on the East Coast, got me this amazing hat. I love the color. I love the warmth that it exudes, and it's a heart with different colors. And I'm like, oh my gosh, this is like speaks to my heart because what I do on a daily basis is help and support not just being a conduit in life by bringing people together in a matchmaking capacity, singles coming to us at Little Gay Book who are looking for quality relationships with other singles who are relationship minded. And they come in all right, like everybody's different. So much diversity and amazingness about everybody we work with. So it just captures, it reminds me of all the colors and all the different preferences and love and so not just in a matchmaking capacity, but also just like how I focus on the quality of connecting and the importance of human connections and relationships. And I talk about all the difficult things here. This is my platform is about talking about tough stuff and learning skills and considering how we can overcome fears. And we bring all different life experiences, all different varying degrees of trauma. We've all experienced trauma. So I just love this because it's a heart that has depth and warmth. And we need all of that today with each other. So we need to exude warmth. We need to have tons of gratitude and we need to embrace and accept difference because we are all different as humans and we don't fit into a beautiful, pretty, shiny box. We just need to like recognize that just because somebody's different doesn't mean that we need to reject them or judge them or criticize them. It just means that we need to be open to difference and be curious. Ask questions, learn, right? Better understand instead of being leading from a place of fear and rejecting. So that's what this hat says to me. And I'm so grateful to my friend for thinking of me and picking a color that speaks to me and all the good things. And in a second here, I'm going to jump into today's topic, but I want to encourage you to subscribe below, click that bell, hit all notifications. Right now, I'm releasing a new video at minimum every week, once a week. So you'll be the first to know. And comment if there's any reactions, any topics that I'm not talking about that you really want to hear about. I'm, one brain. I've got an amazing team that supports me. But, at the end of the day, you're 20 plus thousand people out there that are regularly watching my videos. So you have ideas that I care about. You matter. So come and join in the process. Share if you want to hear more about something I talk about or something I haven't covered. I want to hear from you. So I appreciate all of you. And yeah, let's not waste another minute. What perimenopause means for your sex life? Yeah, I mean, this is really, I'm like in it, experiencing it. And I feel like a lot of my listeners probably also are experiencing it. So let's just talk about it. Let's talk about the nitty gritty. Perimenopause is a profoundly impactful time of life for people who go through it. And also one that most people know very little about. I mean, yeah, like many aspects of health that primarily impact women, it's not talked about as often as it should be by either doctors or lay people. As a result, many of us don't know the changes that happen in menopause and how they can wreak on our bodies and our lives, particularly our sex lives. If you're not sure what this time of life holds for you, you aren't alone. Here's what I think everyone needs to know about what perimenopause means for your sex life. So what is perimenopause? Perimenopause draws from the Greek prefix peri, which means near or around. Fittingly, this refers to the time leading up to or around menopause. Menopause is when people whose dominant endogenous hormone is estrogen begin to decrease their production of estrogen and progesterone, and they're no longer of an age to reproduce. Perimenopause is a time leading to menopause, during which hormones like estrogen and progesterone begin to decrease, but unevenly. They may fluctuate irregularly for a long time, sometimes for years, before true menopause sets in, marked by when someone who usually menstruates goes a full 12 months without a period. Perimenopause often begins in the mid to late 40s, but can also start as early as someone in their 30s or as late as someone in their 50s. Perimenopause has some of the same signs and symptoms as menopause, but can also have unique symptoms. Because hormones are fluctuating and they're inconsistent, perimenopause can look very different from person to person and over time. Some common perimenopause symptoms people may experience include irregular or missed periods, brain fog. Oh my gosh, the brain fog, crazy. Hot flashes, insomnia and sleep problems, fatigue, mood swings and irritability, more frequent UTIs and infections, decreased bladder control, vaginal dryness, weight gain, changing in cholesterol levels, changes in bone density, osteoporosis, and night sweats. Many of these changes can impact someone's sex life, whether they're having partnered or solo sex. After all, your feelings about sex might change if you are feeling exhausted and cranky and dealing with brain fog all the time. There are also direct impacts for many people on both their sexual organs themselves and on their libido linked with perimenopause. What changes can you expect in your body? During perimenopause, the amount of estrogen your body produces begins to fluctuate and ultimately trends downward. There are estrogen receptors throughout your entire body, so the effects of perimenopause are distributed throughout your entire body as well. There are up to 36 possible symptoms of perimenopause. Did you just hear me? 36. That's an insane amount of symptoms. People may have wildly different experiences with them, and two people may have completely different symptoms. Some of the physical changes you may experience during perimenopause include bloating, acne, dry eyes, itchy skin, hair loss, brittle nails, fatigue, body zaps, or the sensation of buzzing in your body, burning mouth sensations, tingling hands or feet, breast pain, headaches, vaginal dryness. Again, it's not necessarily the case that the same person might experience all these symptoms, but you can see how experiencing even a few of these might impact your relationship with your body. Even before getting into symptoms like vaginal dryness that most directly impact your sex life, perimenopause and the associated symptoms can make your body feel like really unfamiliar, inhospitable places to be, which isn't conducive to a satisfying sex life, right? If you're feeling like you don't recognize yourself or your body lately, try to give yourself some grace and patience. Much like puberty felt awkward and uncomfortable for a period of time in your early life, this may feel like a difficult and frustrating transition time too. It won't last forever, and it won't make it go faster to resent yourself or your body. As far as your sex life, pay attention to what feels good and what doesn't. And be mindful that the answers may have changed. Let your partners know that this is a time for them to extend patience and grace. You may be figuring out now new schema for pleasure, and some things that used to work to get you off may not actually be that effective anymore. This calls for creativity and not giving up. What changes can you expect in your libido? People whose dominant endogenous hormone is estrogen commonly report a lower libido or sex drive during perimenopause. This might mean you're less interested in sex, that feels less good maybe, or that you enjoy sex when someone else initiates it, but you're less likely to initiate it yourself. For some people, it can be difficult to distinguish between a changing attitude towards sex is really about a lower libido or a complex mix of other factors related to perimenopause. Fatigue making you too tired for sex, vaginal dryness making sex uncomfortable or painful, or mood swings making you feel disinclined to be intimate with your partner. If you're worried about your libido during perimenopause, a first step could be to try addressing these broader symptoms and making sure you're getting enough sleep, managing your moods and stress, and using plenty of lubrication. You know how much I love lube. Lube, lube, lube. I talk about it. Use it. If a low libido persists, you can explore new options with your doctor, sex therapist, and partner or partners. It's possible that different kinds of intimacies might feel good than what you were into previously. Or you may need more foreplay, flirting, sexting, or fantasizing to get totally engaged in sex, which I talk plenty about, so look at previous videos. What can you do about it? The most effective treatment for perimenopause is hormone replacement therapy. You take supplemental hormones to help level off the effects of losing the endogenous hormones your body is no longer producing. Talk with your doctor to determine whether this is the right choice for you. When and how to approach hormone replacement therapy depends on your symptoms, your health history, and your body. And beware, there are a lot of older doctors, meaning like they have old school thinking about it around the cause of potential cancer or blood clots and things like that. So you want to do research and you want to connect with more than one doctor potentially to figure out what the best solution is for you. I know for me, not using hormone replacement is not an option. I love fitness. I love having energy. I love having nice skin. All those things, or flexibility in my wrists or my knees, like my joints were killing me. An option to not use it just wasn't there for me. So just want to encourage you to do your own research and don't give up if you meet one doctor that says it's a bad idea. But to each his own, right? We all have to kind of weigh out the risks and the benefits and look at our history, our predisposition, family history is really important, stuff like that. If you and your doctor do decide to pursue HRT, there's a range of different hormones you might end up supplementing, from estrogen, estradiol, to progesterone, to testosterone. Though we don't usually imagine we might need testosterone as we approach menopause, it can be helpful in addressing symptoms like low libido and brain fog. Hormone therapy can be taken in a wide range of forms, from transdermal gels or creams to pills to sprays or skin patches. It's also possible to treat the individual symptoms of perimenopause separately from or in addition to hormone therapy. For instance, an estrogen-based cream applied directly to the vulva can help with vaginal dryness, or one might take medications to help manage bladder control or antidepressants to help with the mood swings. Lots to consider. And I encourage you to get out there, start doing some research, talk with your friends and your peers, because if you are at this age, if you're around my age, you're dealing with this. And just it's important for us to talk to each other and explore the options, because we don't have to just settle on brain fog and fatigue and no libido or low libido and physical pain, joint pain. I mean, I can go on and on and on, all the things. So good luck to you all. Thanks for being here with me. I appreciate you. Love you all. Kisses, hugs. I'll see you next week.